Good morning to all those who make this broadcast possible, to Gisela, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with 4,836 people hospitalized in Cuba, 5,693 under observation, 691 suspected cases, and 452 confirmed active cases. Yesterday, we processed 6,807 samples in our various molecular biology laboratories. Samples were processed at the Pedro Curi Tropical Medicine Institute, Havana's Hygiene, Epidemiology and Microbiology Center, Villa Claras, Santiago de Cubas, the Genetic Engineering and Biotechnology Center Lab, the Hermanos Almajeros Hospital Laboratory, the Molecular Immunology Center, the Naval Hospital, the Manuel Fajardo Hospital, the Civil Defense Laboratories, the Fructuoso Rodriguez Hospital, the ICA Laboratories, and Ciego de Avila's Molecular Biology Laboratory. Of the 6,807 samples processed, 15 tested positive for COVID-19. That's 15 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 663,612, of which 5,898 have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. From Artemisa, 109, the most from Havana with 4,211, Mayabeque 241, Matanzas 39, Cienfuegos 101, Villa Clara 235, Sancti Spiritus 992, Ciego de Avila 312, Camagüey 255, Holguín 70, Santiago de Cuba 96, the Isle of Youth Special Municipality 98, and so on and so forth from all of the country's territories. All of the 15 positive cases diagnosed yesterday are Cubans and the result of local transmission. 14 or 93.3% of the 15 positive cases yesterday are confirmed case contacts. This means that 91.8% of all cases on the island since the pandemic began have had contact with someone who previously tested positive for the virus. It was not possible to determine the source of infection in one case diagnosed yesterday. This means that the source of infection in 34 cases reported over the last 15 days is still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 446. Of the 15 diagnosed cases yesterday, 10 are male for 51.2% of all cases, and 5 are female, representing 48.8% of all diagnosed cases on the island. 6 or 40% of the 15 cases yesterday were asymptomatic at the time of testing. Overall, 61% of all positive cases in Cuba since the pandemic began have shown no symptoms at the time of testing. and this figure rises to 69.3% of cases diagnosed over the last 15 days. By age group, 3 positive cases diagnosed yesterday are under the age of 20, one of which is under 18 years of age, for a total of 653 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 590 or 90.3% have recovered from the virus and been discharged from hospital. Meanwhile, 3 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 6 cases are between 40 and 59, and 3 are over the age of 60. Of the 15 cases diagnosed yesterday, 10 belong to Sancti Spiritus, 3 to Ciego de Ávila, 1 to Pinar del Río, and 1 case to Havana. The case from Pinar del Río belongs to the municipality of San Dino. The case diagnosed in Havana is from the municipality of Regla. The 10 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus with 5, Trinidad with 3, and 2 cases to La Sierpe. Finally, the 3 cases from Ciego de Ávila all belong to the municipality of the same name. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 59.03. Sancti Spiritus follows with a rate of 28.93, then Havana with 11.19, Matanzas has a rate of 2.36, Mayabeque 2.08, Artemisa 0.97, Villa Clara 0.26, Camagüey 0.13, and with the 1 diagnosed case yesterday, Pinar del Río now has a rate of 0.17. Cuba's rate therefore stands at 22.05 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,898 people who have been diagnosed with the virus thus far in Cuba, 452, or 7.6%, are active hospitalized cases. Of these, 450, or 99.6%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID-19 death toll on the island remains at 123, with a mortality rate of 2.08%, lower than the global rate of 2.93% and the regional rate of 3.32%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 43 people were discharged from hospital, a positive result when compared with the number of confirmed cases yesterday. 22 people were discharged from hospital in Havana, 3 in Matanzas, and 18 in Ciego de Ávila. This means that, to date, 5,321 people, or 90.2% of all confirmed cases in Cuba, have recovered from the virus. Today, 2 patients continue to be in a critical state in hospital in Havana and Villa Clara. Yesterday, 1 critical patient passed to serious in hospital in Villa Clara. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 276,416 people were diagnosed with the virus, for a total of 35,523,556 confirmed cases since the start of the pandemic. Yesterday, 4,329 people died of the virus worldwide, for a total of 1,042,398 COVID-19 fatalities and a mortality rate of 2.93%. The region of the Americas, which accounts for 48.75% of all cases worldwide, reported 87,407 new cases yesterday, for a total of 17,320,029 people to have been diagnosed with the virus. Meanwhile, 1,839 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 575,278 and a mortality rate of 3.32%. The United States continues to top the list of countries worst affected by the pandemic, with over 7,417,000 confirmed cases. Then comes India, with more than 6,623,000 cases. Then Brazil, with over 4,915,000. And in fourth place comes Russia, with over 1,215,000 confirmed cases. These countries have also registered a high number of COVID-19 related fatalities. The United States, with 209,794. India has 102,185. And Brazil, which despite having fewer cases than India, has more COVID-19 related deaths, with 146,352. From the Americas, after the United States and Brazil, comes Colombia, Peru, Argentina, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, the Dominican Republic, Guatemala, Honduras, and Costa Rica. These are the countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. This is the information we have on the behavior of the pandemic in Cuba and the world.